I've got an arthritic knee, so there's nothing that I can do about it. Now I hear this quite a bit, and it's a misconception that people have. They think because osteoarthritis of a joint is kind of an irreversible process structurally, that symptomatically and functionally they can't improve. But this is actually not true. I've seen many patients before who've got osteoarthritis of the knee, the pain levels are high, the function levels are low, and you can get them back functioning very much better, if not 100%, and you can get their pain levels much better, if not 100%. And this shows that you can influence the symptoms and the realities of that condition, even if you may not be changing the structural components of that problem. So what type of treatments can actually help osteoarthritis of the knee? So today we're looking at an updated systematic review. They looked at randomized control trials of over 18-year-olds who had been diagnosed with osteoarthritis of the knee. Now in the randomized control trials in this review, they were looking at comparisons of treatments to placebo or sham and also other relevant interventions as well. The outcomes that were looked at was pain, function and quality of life. So they looked at outcomes in the short term, which was 4 to 12 weeks. They looked at the medium term, which was 12 weeks to 26 weeks. And they looked at the long term, which was beyond 26 weeks. They looked at many interventions from exercise therapy to manual therapy to electrotherapy. And they found obviously a lot of evidence was lacking in certain areas of treatment modalities. Because you know there's lots and lots of things that are touted out there for various things such as arthritis of the knee, and they obviously found evidence was shy on a few of these areas, but they did find certain things and they did recommend certain things on the basis of this. So firstly, in the short term, what did they find was effective and therefore recommended? Now they found that TENS, which is basically an electrotherapy treatment that just helps for pain relief effectively, and that helped in the short term, which makes sense. Although you could still say, does it really help? But people use TENS a lot, and this systematic review of randomized control trials showed short-term TENS is certainly potentially viable in some cases. They showed strength and resistance training, even in the short term, was also an effective treatment for osteoarthritis of the knee. And some people might be surprised by this, but remember, strength training, resistance training can start very, very light, very, very low, within tolerance, and then be built up from there. It doesn't have to be giant, heavy squats to the full depth and so on. They can be modified to the individual and should be modified to the individual. And it shows here, strength training, resistance training, short-term, beneficial for osteoarthritis of the knee. Tai Chi, so obviously an exercise which is very gentle, smooth, movement control, postural control, again, makes a lot of sense, shows that's effective too. Agility training, so basically training which is like a bit plyometric, jumping around, control kind of aspects like hopping, directional change sort of stuff, zigzags and stuff like that. It's surprising to be in the short term because you assume the impacts are high, but the evidence shows that agility training in the short term is also effective for osteoarthritis of the knee. And the final thing they recommended was home exercise programs, which of course as a physio I give out to everybody, so there's no surprise there. So what did they find in the medium term? What did they recommend and what did the evidence support for the medium term? So this is between 12 weeks and 26 weeks after treatment intervention. So weight loss was the first one, which we do know there's a huge correlation with knee pain, osteoarthritis of the knee, and being overweight. So obviously, provided that there is overweight or obesity, then weight loss is definitely recommended in the medium term. Intra-articular platelet plasma-rich injections. So this is just basically where they take the plasma, which has got lots of platelets in, and they inject that into the joint, into the knee joint. And this is sort of supposed to stimulate some sort of healing sort of type of response. And this was recommended in the research in the medium term. Glucosamine and chondroitin. So I do have glucosamine and I do take glucosamine, and glucosamine is very much part of, been a long time around for arthritis in the joints, in the knees, in the hips, whatever. And this is recommended with chondroitin as well in the medium term. General exercise programs, so this gets a bit broader now. Exercise of most types that are programmed obviously specific to the individual is also beneficial medium term. Tai Chi once again is also on the list. A stranger one here, whole body vibration training, so that's where you're on the vibro plate and you're doing some exercises there. Interesting why, but obviously it was shown in this research, in this systematic review. Now what about the long term? Again, general exercise programs are in there as well. Agility training is back in as well. Manual therapy's in there as well. So that's anything hands-on, mobilization, manipulation, soft tissue mobilization, massage, whatever, all that sort of stuff, again, is in there. And weight loss, no surprise, is still in there as well. Now this is really interesting because there's some surprises in there. There's some obvious ones in there, but there's some surprises in there. The surprise first was agility training in the short term. You kind of think, oh, that's unusual. The other interesting one was manual therapy in the long term instead of the short term. You would have assumed it's the other way around, but actually they showed that it was definitely helpful long term, which is good. You know, I mean, why not? Obviously, weight loss is obvious. Obviously, weight loss just isn't in the short term just because you're not going to lose significant weight in the short term. It's going to take a bit longer. So obviously, you should initiate weight loss from day one, but you're not going to see the benefits of that until the medium or the longer term. And obviously TENS made sense to only be short-term effect. Obviously it's not going to have a long-term outcome or a medium-term outcome. So overall, this shows you that exercise is good. Exercise can be started early and should go all the way through. You can use TENS a bit in the short term for some pain relief. It shows you should start weight loss early, but you're not going to see the benefits of that until a bit later. It shows manual therapy is actually beneficial, and it shows it's beneficial more in the longer term, so that's a good thing as well. It shows that, you know, some supplementation, some glucosamine, some chondroitin certainly could help in the intermediate term, as well as a platelet-rich plasma injection. So there are lots of viable treatments that they found here, and it was interesting to see their effect in the short term, the intermediate term, the long term, and it shows you that you can actually make a difference to your arthritic knee, and you shouldn't just put up with it. You can add loads of treatments in if you're in a lot of pain to bring the pain under control. You can phase into more difficult things. You can add in some manual therapies. There are injections, but not necessarily steroid injections. There are plenty of things, some supplementation like we said. So don't just put up with it. Consult a physio. Get some exercise programs into there. Get some manual therapy into there. Get your weight down if that's needed. Loads of things you can do. So anyway, that's it for this video, and I'll see you next time.